Hello, this is Dr. Eric Bricker, Chief Medical Officer of First Stop Health, and today's topic is the growth of virtual care adoption. So I'm going to start off with a few statistics. So in April of 2020, during the start of the worldwide pandemic, use of virtual care or telemedicine increased 78 times what it had been just a few months before, for obvious reasons in terms of wanting to avoid contact, whether it be with other people in the waiting room or with potentially sick people who are in the healthcare setting. But what we've seen is that telemedicine and virtual care has continued to be highly used even through the waxing and waning of various parts of the pandemic. And so even today, now in the summer of 2020, recent surveys have found that consumers are still 4 times more likely to use telemedicine than they were pre-pandemic. And we've also seen a huge increase in the use of telemedicine for mental health and psychiatric services as well, where consumers are 2 to 3 times more likely to use telemedicine for mental health services than they were pre-pandemic. So this then begs the question, why? Why is it that telemedicine had been and virtual care had been around for a long time before the pandemic, but it took this global tragedy, unfortunately, for this to happen? Well, it was in many ways because we as individuals follow this sort of herd mentality of what's referred to as the technology adoption lifecycle, where you have early adopters that used telemedicine before the pandemic because these people were open to doing new things, and there's always a subsegment of the population that's open to doing that. And they've actually done studies on this, and guess what? It actually comes down to a percentage. It's about 17% of the population does that. Then there's a group that's called the Pragmatists, and they'll do it as well, but they need to have a specific pain point or a problem that they're willing to solve. They're not just willing to do it because it's new, they're willing to do it because they've got a problem with it. Well, think about what was the problem that pragmatists were ultimately trying to solve for. Well, before they used to go to the doctor's office, they would have to take the time to get there. They would have to battle traffic. They would have to potentially pay for parking. They'd have to wait in a waiting room for a doctor who was probably late. They'd have to miss work. And they'd probably have to arrange, or if they were doing it after hours or before hours, they probably had to arrange for some sort of child care. So here they are, you've got these busy people juggling all these things, and you have to deal with this huge hassle. And telemedicine allows you to essentially throw that hassle away and still get care in an almost infinitely more convenient fashion. I mean, anecdotally, everyone who I've talked to who has since used telemedicine, they're like, why would I ever go back? It is so much easier than having to deal with all the things that I just mentioned. And guess what? Pragmatists make up about 33% of the population. So if you add up the 17% plus the 33%, then you get about half the population that is like actively using and interested in using telemedicine, which is awesome. And it just shows how employers are riding this wave as well, where over 90% of them believe that telemedicine is going to be an important part of their strategy going forward. And that's what I wanted to share with you today. Thank you for watching.